The direct ophthalmoscope is the main piece of ophthalmic examination equipment that is used in first opinion practice. Often its use could be improved, both in the way that it is employed for ocular examination and also in the order of procedures carried out in the full ophthalmic workup. In this section, the instrument and its controls are first described, and then the correct usage of the direct ophthalmoscope is demonstrated during the different sections of the ophthalmic examination.
The direct ophthalmoscope comes either as an attachment for a wall-mounted mains unit or a handheld battery unit. The voltage of the handle and bulb will influence the colour of the end of the ophthalmoscope. Most manufacturers use a blue handle for a 2.5 volt and red for 3.5 volts. Mixing the two up may result in a blown bulb. It's important that the battery is charged in order for the unit to work, and this may be checked by turning the ophthalmoscope on prior to initial examination. The handle is designed with a rheostat so that the light intensity can be altered, and it's important to keep the light as low as possible to prevent discomfort for the patient. Remember that our patients are much better at seeing in dim light than we are, and that the light source will appear brighter to them than to us. Looking at the ophthalmoscope, we can see that there are several dials on it. On the underside is a selector dial for the light aperture size. This will alter between a large open beam, middle and narrow beams, slit beam and also graticule. The size of the light beam should be adjusted depending on the size of the pupil. The slit beam may be used to identify a swollen or enlarged optic nerve head. In this case, the beam will deviate towards the examiner. Conversely, where an indentation, such as a coloboma, is present, the beam will be deviated away from the examiner. Also on this dial, or in close proximity to it, is a light colour selector. This allows the operator to select red-free or green light, cobalt blue light, or white light. The green light will help with the retinal blood vessel examination, and cobalt blue light will help with fluorescein examination of the cornea. The diopter settings are located on the side dial, with the clockwise direction being positive diopters and the anti-clockwise direction being negative. There may also be a separate dial for large diopter changes, e.g. plus or minus 20 diopters in one step, depending on the model of the ophthalmoscope being used. Now that we are familiar with the instrument, we can think about how to use it in a clinical case.